The following program is sponsored by El Camino Hospital in partnership with Blue Orchid Press.
1 in 8 women will develop breast cancer. Are you at high risk? Don't wait to find out. The key is early detection. Get the information, screening, and advice you need for your overall breast health right now. Hi, I'm Nurse Barb with your Daily Dose, and I'm here at the Breast Health Center at El Camino Hospital, where women are receiving the best state-of-the-art diagnostics, imaging, and treatment for optimal breast health.
Actually, what brought me into my mammogram was I had breast changes, so I felt almost like when I was pregnant. I felt a heavy kind of surge feeling, and I knew that wasn't normal, so I thought, well, I need to go in for that overdue mammogram.
Here at El Camino we have digital imaging, so we have digital mammography with computer-aided detection. Women of Asian descent have higher breast density than other women. The digital mammography is especially good for patients who are under the age of 50, who have dense breast tissue and are pre- or perimenopausal. We also offer computer-aided detection, which is basically a software program that highlights areas that may be abnormalities, and the radiologist would take an extra look at those areas.
I have dense and cystic breasts, and then in addition to that, the kind of cancer I have was lobular, which is harder to find. So between all of those, I'm so grateful that I had early detection.
Did you know that less than 1/2 of women in the U.S. who are at higher risk for breast cancer are being cared for appropriately? But that's not the case here at the Breast Health Center. When women come in for their mammograms, they'll be offered an easy-to-use app that will help determine if they're at higher risk for breast cancer.
There are a lot of questions about family history that will be on the risk assessment tool. Other things will be related to hormonal influences during their lifetime.
Combining state-of-the-art breast imaging with the high-risk assessment tool means that every woman will get a plan tailored to her own unique situation. And what does that mean? Peace of mind.
We'll soon be launching the high-risk breast and ovarian program. In this program, we will assess patients, identify their risk, and then educate the patient about their risk and what it means. But with this, we'll also offer a holistic approach.
No woman ever wants to hear that she has breast cancer. But if this happens, one of the most important things she can do is get the support and information she needs as quickly as possible.
At first it's scary and uncertain and just, oh my God, I have cancer. So that feeling of, oh my gosh, it's me, to, okay, what do I need to do? How do I get through this? And just going through the steps to, I can get to the end point and move on.
How soon can they see a specialist here?
A new diagnosis of breast cancer can be an emotional emergency, and for that reason, we feel it's very important to get those patients in as quickly as possible, and we certainly try to see them within 48 hours if we sense that it is urgent for them.
When it came time for the radiation, I looked into brachytherapy because I wanted to know, why would I choose that over the whole breast radiation, and make sure I was making the right choice with that as well.
In the past of doing radiation for breast cancer has been an external beam, and this is a treatment that takes 6 or 7 weeks. With the brachytherapy treatments, we treat only the tissue that's at highest risk for the recurrence, and the way the treatments are performed, it's going to be performed with 10 treatments that are given over a 5-day course.
Did you know that when breast cancer is detected early, there's over a 90% chance of a full recovery? If you or someone you love is concerned about breast health, call or go online to find out more information about the new high-risk breast health program at El Camino Hospital. And make a commitment to get your mammogram this year. This is how I'm making my commitment to my family and friends. It's called the Pinky Promise. And I hope you'll make a pinky promise to have your mammogram this year too, and support someone you love to do the same.
Get through all the process, get through all the things you need to do, and then go on and live your life.
And remember, always get the information you need to make the best decisions for your health. I'm Nurse Barb, and this is your Daily Dose.